ultimately what 2023 is shaped up being is a conversation around artificial intelligence. But that can't affect each and every healthcare startup, or can it?
Well, we at Bessemer have made a really large commitment to AI, and I would say that healthcare is actually one of the industries where it's going to be most relevant, most impactful. And the reason for that is, healthcare is the most laborious, inefficient industry in the economy. It's also 30% of the world's data. And so if you think about that combination, what is artificial intelligence good at? It's good at automating tasks in all parts of our economy, but we think in healthcare it's going to be really impactful. Basically everywhere from how the payment in healthcare is administered on the back end, how healthcare is delivered, by clinicians in terms of clinical decision support, for instance. AI can be very impactful. And then also how drugs are designed and delivered to improve human health. And so we think all aspects of the healthcare economy are going to be revolutionized by AI.
The problem with 2023 is suddenly we felt that AI was this bright, new, shiny object, and ultimately artificial intelligence has been in an unsexy topic for years. And I'm interested as to, therefore, for you, was it about starting to amplify the AI story amid the companies you've already backed? Or is it finding new companies that are being built out of this sudden leap change that we did see with generative AI?
I think it's both. We've actually been investing, you're right, it's been around for a long time, these technologies, and we've actually been investing in 5+ years in terms of how these technologies are applied to healthcare. And I mentioned some of the ways that could be. And so I think there's going to be plenty of new opportunities that come out over the next decade of how AI can be applied to healthcare. But I also think for existing companies, as you point out, I talked about how healthcare is a very laborious industry. A lot of it's services, humans doing tasks that actually can be automated, that are pretty mundane, but are very important. And so we actually think AI is going to shift services to more software, like in their administration and how care is delivered.
What has it done to the valuation story of the companies that you're looking to invest in or already have them?
Well, AI is a hot space, and I think, the valuations in the AI sector are pretty robust. But we also think the opportunity is equally as robust. And if you think about it, in my career in venture, there have been several platform changes, moving from on-premise software to the cloud. That was a huge, huge shift in our economy and created hundreds of billions, trillions of dollars of innovation entrepreneurship. The iPhone, right? Huge moment. AI is also a huge moment. So while, valuations are heady, I actually think the opportunity is almost uncapped. And so we're excited. And that applies to healthcare AI companies too.
And maybe even some exits. I mean, talk to us about, when you're thinking of Bessemer Ventures, I think of, well, some of the unbelievable companies that have gone public through the Pinterest that you've been sort of back from early days, and some of the other Twilios, LinkedIn's. Who are they in your current source of portfolio companies that you've invested in? Where do we see those exits coming from?
Yeah, I think it's the AI wave. We're early in it, and so I think those exits will come in 5-10 years. But right now, one area that we've invested in is just the digitization of the healthcare economy. Again, it's often been experience where people get their healthcare in person, but we saw that COVID actually unlocked the whole idea of telehealth. And so we think all throughout the delivery of care, whether it be companies like Headspace Health or Hinge Health. Headspace is obviously focused on mental health care, which, as you know, has been an area where, frankly, there's a lack of supply of clinicians in the US and in the world. And so a company like Headspace that delivers really important, high-quality mental health care to all. If you have an iPhone again, that's a huge, huge opportunity that we think is going to run for a long time. And also a company like Hinge, which is doing the same when it comes to back or knee or hip pain, being able to deliver that care like physical therapy. You don't have to go to see your physical therapist in person. You can actually do that care via your iPhone. Again, a huge market opportunity. And we think those are the companies that we're going to see, get to exits in the near term.
You're based on the East Coast, but up in Boston.
Yes.
Where are those opportunities coming from? Where are these companies being built at the moment, do you think, that you're going to be looking to in 2024?
We at Bessemer have long believed that, Silicon Valley is obviously a hotbed of innovation, but Boston's a hotbed of biopharmaceutical and healthcare innovation, New York. But frankly, we've invested all over the United States and all over the globe. We have offices worldwide. And so we actually think entrepreneurs can be anywhere. And frankly, one of the things that, remote work taught us is that, entrepreneurs are everywhere and people can work everywhere. And so we've invested in everywhere from Minneapolis to North Carolina to London, Israel, and all across the globe. And so I don't think entrepreneurs are limited in where they live. I think it's that spirit lives everywhere and the possibilities are everywhere.